We operate on at least 100 children each month. Pediatric neurosurgeon takes care of children who have problems in the brain that need operations. Here in Kajabi, the most common one is hydrocephalus, too much spinal fluid inside the brain. The second most common one is spina bifida. Now those two diseases together are 60% of all of the operations that I do. And that's between 12 and 1,300 operations per year. The other 40% is children who have brain tumors or head injuries or other congenital problems in the brain and spinal cord. The hydrocephalus that we see so much of, most of it is related to spina bifida. The spina bifida that we see so much of, and last year we admitted 249 children. So that's like one new baby with spina bifida Monday, Tuesday, Wednesday, Thursday, Friday, every week, all year long. It means that when the baby was developing in the uterus, in the womb of the mother, very early in pregnancy, like 24 to 26 days before the mother knows she's pregnant, the spinal cord did not form like it should. Usually in a fetus, the spinal cord begins as a flat sheet of tissue. And normally, that flat sheet folds over and becomes a tube. That's the spinal cord. But in spina bifida, in one area, sometimes over the ribs, sometimes down low, it just stays flat. So the brain and spinal cord, they work down to that point, and the nerves from there down to the legs work, but there's no connection between the spinal cord and the nerves. So the babies are often born unable to move the legs. Sometimes they're completely paralyzed, sometimes it's mild, just a little bit of weakness, and sometimes it's in the middle. We know that there's two things that are related to spina bifida here in Kenya. The first one is the mothers never take folic acid before they get pregnant. And if they take folic acid after that, it does not help. They have to be taking the folic acid when they get pregnant. If they do that, it decreases the chance of spina bifida a lot. It does not prevent it, but it decreases the chance a lot. Now there's one other thing in Kenya that increases the chance of spina bifida, and that is maize. Maize. So often the women, they grow the maize on the farm, right? They get the maize and they take it to the local miller. He grinds it up, he puts it in a sack, and then either he stores it in his barn, or the mama takes it home and she stores it somewhere, but it gets mold. Mold. The mold is a fungus. And the kind of fungus that gets onto the maize is terrible. It produces a chemical called fumonisin. And that chemical, fumonisin, prevents the spinal cord from folding over into a tube. And so they have two problems. One is they do not take folic acid, and the second one is they eat maize that has mold on it. Most of the spina bifida we see is for people who do not live in Nairobi. They live out in more poor areas of Kenya. They don't take folic acid, and they have maize with mold on it. So it's a terrible problem. Kajabi does more spina bifida operations than any place in Kenya. They do a few in Eldoret and very few in Kenyatta. Some of the operations are, I wouldn't say they're easy, but they're not too difficult. But some of them are terribly difficult because 15% of the babies with spina bifida they not only have the open spinal cord, but the bone underneath it, instead of being straight, it comes up like a mountain and goes back down, and the spina bifida is on top of that. So you need to treat those abnormal bones, and that's difficult. The amount of spina bifida that we see here in Kenya is, it may be the highest in the world. The only place I know that is similar is the All India Institute of Medical Sciences in Delhi, India. I mean, they have, I think, six pediatric neurosurgeons, and people come from, all over India, which has 1 billion people. 1 billion, right? We have 42 million. But we have at least as many as they do, and maybe more. There's no place that I've been in South America, in Africa, Nigeria, South Africa, Tanzania. Nobody has as much as we do. So a terribly important point is that what usually happens if a baby is born in Kenya somewhere, they are taken to the local hospital and they may be given antibiotics for a week or 2 weeks or 3 weeks, and they say, we're going to do the operation in a week or 2 weeks. It never gets done. And so the baby comes down here sometimes 2 weeks later, sometimes 2 months later, sometimes 2 years later. But the time we need to see them is when they're born. And babies should come when they are born within 1 or 2 days, rather than going to a hospital where people do not know how to take care of babies with spina bifida. No one treats anywhere near the number of babies with spina bifida that we do. Very few babies, when they are born with spina bifida, come here in the first 2-3 days. Babies often have some weakness in the legs. Sometimes it's mild, sometimes it's medium, sometimes it's complete paralysis. They also usually have difficulty urinating, passing the urine out. And so for most of them, the mothers need to put a catheter, a small tube, up into the bladder about every 3 or 4 hours to drain the urine. If you don't do that, the urine goes back up into the kidneys, enlarges the kidneys, and damages them. But the mothers do that for the first 4, maybe 5 years, and after that, the children do it. The boys or the girls. And that is a lifelong problem. Right now, there's no way to fix it so that we can help them to urinate on their own. Sometimes later they would have some orthopedic problems in the legs or in the spine. When the baby comes with spina bifida, I can close the back so that it's covered. Treating it is not the answer. The answer is preventing it. Well, the first thing is to educate mothers that they need to take folic acid when they get pregnant, right? Now, that education should come in high school. There's a lot of girls in high school that have sex. I mean, I've seen certainly 14-year-olds here with their babies, right? I don't remember a 13-year-old. So when the girls go through puberty, when they're 10, 11, 12 years old, they need to learn about spina bifida. They need to learn about folic acid, and it needs to be available free. Even if it's an unplanned pregnancy, if they're taking folic acid, the chance of getting spina bifida is much less. They may have a surprise of a baby, but they will not have the surprise that that baby has spina bifida.